Tapestry began as the Family Planning Council of Western Massachusetts back in 1973. As times changed, services were added, for example, food access with WIC, and then drug user health, and all these services formed a Tapestry. It's interesting because COVID-19 didn't change the services that Tapestry offers. Tapestry just started offering those same services in a different way.
Reproductive health care doesn't stop because we have a stay-at-home order. It's an essential service, it's a human right. So for us to be able to provide access to reproductive health care, even if it's a little different than what we normally do, is essential. During the COVID-19 pandemic, Tapestry started delivering virtual visits. For those we cannot serve by telehealth and that do require a face-to-face visit, we are accommodating those visits through hours designated as direct care hours.
We live in a day and age where schools aren't really doing a ton around sex education, where they're not doing a ton around drug education and safety and forethought planning, so that folks, maybe they're not using drugs now, but maybe they potentially would later. But if they receive the education now, we could actually curb that later for them, or at least have them make healthier decisions about themselves is really, really important. It's not always about just saying, don't use drugs. It's more about make educated decisions about yourself and how you can keep yourself healthy.
Tapestry's harm reduction services has always provided essential services to the most marginalized populations in Western Mass. A lot of essential services have been disrupted for people who use drugs and for others that are vulnerable. So the need to really meet people where they're at has increased tremendously. There's been additional barriers to things like accessing food or accessing public transportation, accessing detox and other forms of treatment, accessing medication for opioid use disorder. So all of these barriers has caused an increased amount of isolation and fear among the people who use drugs. So Tapestry has responded to that and literally taking the van out and going to places where we know that people are and literally meeting them where they're at.
During COVID is very important because people are losing their jobs and people are getting furloughed. So obviously we know there's a need out there. Even before COVID, there is always a need out there for food assistance. We have now, you can apply online and we'll get that application and we'll give you a call. And we'll do like a screening over the phone and see if you qualify. Even if you're getting unemployment, you do qualify. Even if you're not getting paid, we would make the exception of making you qualify for a program and just, getting the services that you need during this time.
As a small nonprofit that's been around for all these years, we've managed to keep that sort of personal touch in a way, while still providing the competence and the compassion.
Tapestry serves an essential population of folks, and they are at the greatest need, and we want to continue to be here when folks are ready to receive those services.
With Tapestry staff is that their heart is in the community. They know the population that we serve. They know the community, they live it, they walk it, they see it. Our services are greatly needed out in the community. We're bringing our services to them.